In this video, we'll create a new patient and set up a wound case. I'll walk you through the entire intake workflow using a sample patient. To start, click on All Patients and then on Add Patient. Once the patient intake form is open, you will need to fill out the required fields: first name, last name, date of birth, primary phone number, and address information. The system will automatically flag any duplicate patients based on name and date of birth to prevent duplicate records. Next, you will need to add the referring provider and insurance information. These fields are important for billing. The HCPC's codes we document in visits will tie back to the insurance information you enter here. Once the required fields are complete, click Create Patient. The patient is now in your system and you will be taken to their patient profile. In order to access the patient profile, you will need to go to All Patients and then find the patient you just created. You click on View, and then you will be taken to the patient page with all of their information. If you want to create a wound case, you just need to click on Wound Cockpit, then click on Initial Evaluation. Once you're here, you can click on Start Timer if you want to keep track of how much time you spend with the patient. Within the initial visit section, you'll find a complete step-by-step guide outlining all the information required to properly document the visit in compliance. To add a new wound, you will need to go to Wound Assessment and then click on Add Wound. Now we will create a wound case for this patient on his profile. Each patient can have multiple active wound cases. For example, a patient with bilateral diabetic ulcers would have 2 separate cases. Once you click Add Wound, you will need to add the wound location information. Then click Add to List. Once it's added to the list, you can click Add One Wound, and it will show on the New Wound Case Setup section. You set the wound classification system for the situation. Then you need to fill out all of the required fields for this wound assessment. And once you're done, simply click Mark as Complete. If any required fields are missing, a notification will appear on the right-hand side indicating what still needs to be completed. Once all is complete, you can hit Save Wound Case. The wound case is now open and you will see the Wound Cockpit. The Wound Cockpit is the central hub for all activity related to this wound. From here, you can visit history, track measurements over time, manage IVR orders, and launch the treatment wizard. We'll cover the Wound Cockpit in detail in Video 7. You've successfully created a patient and wound case. In the next video, we'll set up your vendor relationship in the CRM so you're ready to place IVR orders.